Hello everyone. Today I'm going to start with a new topic in connection with what I had been talking about, that is welfare state. Today I'll be speaking on welfare services, that what are important aspects of welfare services and how welfare services, as we know, which is in the context of social policy, how they are interconnected, and what are the important aspects related to it, what future trends would be there, what is the delivery mechanism of welfare services, I mean how the services are being rendered, and so on and so forth. So as we proceed the lecture towards this lecture, I hope it is going to help you out and serve you in best interest. Talking about the introduction to welfare services, it if you talk about the conceptual aspect of welfare services, it involves understanding, or it involves in the understanding of the guiding principles, structures, and objectives which shapes the provision of welfare within a society. Welfare services are important and are designed to meet the basic needs, basic human needs, enhance social functioning, social security, and promote social justice. It is services. These services are provided by the government or the organizations to support individuals in times of crisis, in need of any kind of be it financial need, or be it social aspect, or be it health or education facilities. So the framework is typically built on the interplay of governmental, non-governmental, as well as community efforts, or to ensure that the citizen community efforts, as well as voluntary institutions, to ensure that citizens have essential services available to them, such as healthcare, housing, educational aspect, etc. The environment within which within which the social welfare services are being provided, rendered, has gone through tremendous change during the past 15 to 20 years, and the change has been brought about largely by the changes in the socio-economic and political situations in a respective country, which necessitates a legislative, as well as which also talks about it also talks about the timely review of policies and welfare measures and schemes to make the social welfare programs and services responsive to the needs of the poorest. Of the poor, the marginalized, as well as the most vulnerable groups in the society. So it caters to a broad range of services. Welfare means to a various sections and segments in the population. Of course, the basic idea, the basic agenda, and the basic motive of welfare services, it is to provide. To enhance the quality of life. The basic idea, the basic objective of welfare services again is to enhance the quality of life, improve their conditions, promote social inclusion. It talks about reducing poverty. It talks about equal opportunities, freedom, and choices. If we look into the historical development of welfare services, this has evolved during centuries, which is influenced by social, economic, and political conditions of any nation, or from any country. From early charitable and relief system, it has now become to a more modern, organized, formal welfare states. Welfare services have, through the mechanism, or through the social welfare administration services, and so the welfare services have transformed to become a more formalized system, which aims at addressing societal issues, societal needs, issue problems, promoting equity, and ensuring a basic standard of living. Now, if you look into the historical, or if you trace the historical aspect of welfare services, the early beginnings were in the charity and relief for religious aid, that is in the pre-18th century, and welfare support in ancient societies, or we can say, it was largely provided through religious institutions, family networks, and community support system. In fact, in many ancient civilizations, including Egypt, India, China, Greece, religious beliefs emphasized more on those who were destitute, those who were poor, those who were sick and elderly. The poor laws, had there was this various aspect of like poor laws and almshouses in Europe. So in medieval Europe, the church played a very significant role in the welfare, providing secular authorities. It establishes the first poor laws, such as the English poor laws beginning in 1601, and which aimed at addressing poverty through local parish system by offering food, shelter, clothing, etc. So this early model, it treated poverty relief, or rather it spoke about poverty relief as a local moral obligation rather than a state responsibility. And industrial revolution also paved the way. In fact, if I say that industrial revolution and the rise of the welfare state in the 18th and 19th century, the impact of industrialization, the industrial revolution led to a mass urbanization, poor working conditions, prolonged working hours, and economic instability. In fact, there was this surge, or there was this migration of from the agricultural sector to the urban areas in search of better employment and better living standards. So it caused a surge in poverty in social, and it attributed, or rather it aggravated the more social issues and social problems. And as traditional system of local charity, local charity struggled to cope up the idea that the state should play a role in welfare began to take root. So this, with this industrial revolution, the whole idea started to started generating that there should be welfare measures in order to bring about balance in the society. So there was this in England, in fact, the Poor Law Amendment Act of 1834, which introduced workhouses where the poor were required to work in exchange for basic necessities. Now, this period marked a shift towards a more institutional approach to welfare and assistance. More assistance which offer certain conditions which were more effective. So then in Germany, in fact, Bismarckian social insurance in 1880s in Germany under Chancellor Otto von Bismarck, and he had introduced the first social insurance program. He had talked about first insurance program, which included health insurance, accident insurance, in health insurance in 1883, accident insurance in 1884, and old age pensions in 1889. So this model, which was being founded by the contributions from workers and employers, they set the foundation for a modern social insurance programs, and demonstrated the state's role in managing social welfare issues and social welfare measures to be taken up for to cater to these people. Then there was this progressive era and the rise of social reforms, which was in the late 19th and early 20th century. Now there was this growth of social reform movements in the United States and Europe. The late 19th century and early 20th centuries, new social reformers came into existence. They started advocating for improved working conditions, for child labor laws, for child labor laws, education, and women rights. This era brought great attention to poverty as a societal issue other than as an individual failing. Then public health and educational reforms also were given weightage. The government started investing in public health and educational means recognizing the economic and social benefits as more benefits of a healthier educated population. And in fact, public education system and sanitation, it improved market growth rate, which involved in the welfare schemes and welfare programs. Then the government had also taken, in fact, labor laws were also being treated, labor laws were also given certain considerations, and labor unions, they had gained a lot of power during this time, in the sense their rights were taken up, worker rights were being initiated, minimum wage laws were made, safe working conditions were made, durable working hours were made. So these measures were aimed all to reduce poverty and create a more secure working class, which would contribute to the foundation of welfare state. Then came the rise, then came the era of the Great Depression and the birth of, modern welfare states in 1930s. And when we talk about the impact of the Great Depression, the economic devastations of the in 1930s revealed the inadequacy of the existing welfare system, which led to a widespread unemployment and poverty. In fact, which in response to this, the government implemented large scale social programs to address this crisis. In fact, there was this new deal made in the United States where President Franklin D. Roosevelt dealt, or rather established a new deal, a new order, which focused more on, or rather, they created more programs which were as programs such as social security, unemployment insurance, and public works projects to provide jobs and financial stability to the people and to public works projects to provide jobs and economic relief, financial relief. This marked a significant expansion of the federal government role in welfare and the state foundation and its role in welfare, and it set the foundation for modern social safety nets. Welfare reforms were taken up in else part of the country. In many of the European countries, they also started implementing reform movements. The Scandinavian countries particularly, they pioneered extensive social welfare programs, while Britain also had taken lead and passed the National Insurance Act, which would offer health, employment and other benefits to the larger population. Then there was this post-World War II expansion of welfare states, which was in 1940s and 1970s. The Beveridge report in the British welfare system in UK in 1942, they did a groundwork for a comprehensive laid the groundwork for a comprehensive welfare state, which recommended universal social insurance to address, the five giants: want, disease, ignorance, squalor, and idleness. So these were the major issues which needed to be tackled during that point of time, because this was quite rampant during that era. And this report led to the establishment of various of national health services and other welfare programs. Expansion of social security also happened in the Western country. The post-war economic boom in the Western countries allowed for the expansion of welfare services. In fact, programs in healthcare, education, housing, income support became widely available, with countries like Sweden, Norway, Denmark establishing a universal welfare states, which is based on the principle of social democracy. And in fact, decolonization and welfare in developing nations also took part as colonies gained independence. Newly formed governments in Africa, Asia and Latin America, they developed health and education. They developed welfare policies which focused more on eradicating poverty, alleviating poverty, healthcare, providing healthcare accessibility and educational means. Many of the nations embraced social welfare policies to foster development and address social inequalities. Then the rise of neoliberalism and welfare retrenchment, which was in 1980s and 1990s. There was this shift towards market-based approaches. In the 1980s, the economic crisis and rising debt led many governments to reduce welfare policies or welfare spendings, privatizing services and adopting neoliberal policies. In fact, this period saw an emphasis on reducing the role of the state in welfare by influential by various leaders and scholars. In fact, it was now considered, or it was concentrated, since a lot of expenditure was taken up for the welfare measures. So now it was being decided that it would be a conditional and targeted welfare approach. So welfare programs became more targeted, with a focus on means tested benefits rather than universal entitlement. So policies such as workforce emphasize employment as a condition and for receiving welfare benefits, trying to reduce dependency on social assistance programs. Then the period of globalization and the transformation of welfare, that is 2000, and if we say the present part of it, there has been a tremendous expansion in India. If I talk about an Indian aspect also, the post-colonial, the post-independence phase, when the Planning Commission was constituted, when 5-year plans were made in social welfare, where India was declared a welfare state, which I had discussed at length in my previous lecture, that how India, being a welfare state, provided those services, and what were the welfare services, welfare aspect which were taken up since 1950 onwards. First, the Planning Commission, which was constituted, the planners, that they, within the 5-year plans, just not only talk about economic growth and development, but it also looked into social aspect and social welfare services which were being made through social welfare, or which were being transferred, which were being delivered through the social welfare administration. So these measures were also taken in India. So if you talk about the current scenario of, or rather how globalization, as well as there's a transformation of welfare since 2000 and in the present situation. So many low and middle income countries adopted the welfare programs, such as Brazil's Bolsa Familia and India's Manrega program. These programs were supported income international, these programs which provides some employment safety nets to the people. It targeted poverty alleviation. It also talked about social inclusion. Then there was advances in technology have also allowed the governments to implement effective conditional active welfare schemes which would offer financial aid to low income individuals, which provide a safety nets to the people to protect their rights and entitlements. And in fact, healthcare and universal basic income debates were also they take into consideration that there had been a focus on social inclusion, and modern welfare services have now evolved to incorporate rights-based approaches, focusing on inclusion, gender equity, and access to education for all. So this shift reflects a broader understanding of welfare as a tool for empowering individuals and ensuring a baseline quality of life. So this was a little bit of a brief about the historical aspect and how welfare services taken the center stage and how prominent they had become. If we have to talk about a more secular, more democratic, more federal and a welfare state. Now there are various types of health services. How these various welfare services are provided to the individual, and what are the various categories. No, they encompasses a wide range of programs and the support system which has been designed to meet the basic needs, improve the quality of life, promote social and economic equity, and these are often provided by the government bodies, non-governmental organization, institutions, voluntary institutions, and sometimes even private entities which would aim to promote, or which would aim to protect and provide some kind of support to the vulnerable populations, and trying to reduce inequalities. Now if you look into the various areas, it could be types of welfare services, or it could be categories of welfare services, or the areas in which these health services are there. If we take it separately, like healthcare services, now there under the healthcare services is the public health service, which includes government funded programs and initiatives that provide medical care at a very low or at a very at a low cost, or minimum expenses are involved. Services may cover preventive care and primary care, vaccinations and community health programs. Then there are health insurance program, welfare health insurance, such as your medical aid in any part of the country, or Ayushman Bharat, which is in India, which offers a huge major coverage to low income group or vulnerable population, reducing financial barriers to healthcare system. Then there is maternal the health services, which caters to the maternal and child health services, improving the health outcomes of for mothers and children, and the nutrition support and vaccination which we provided. Then there is income support and financial assistance program, unemployment benefit are there, this helps when we talk about these benefits. These provide when we talk about these health insurance, or maternal when we talk about the income support and financial assistance program, these benefits provide temporary income support to people who are out of work or who are unemployed due to layoffs or due to economic downturn, or any agricultural crisis. And then there are also certain benefits in terms of sickness, in terms of disability. There are pension schemes which are provided at the old age. There are education and pension old age government pension schemes, like social security measures are there. In India also you have some kind of financial support and some kind of assistance to the old age, to the widows, etc. Then there is education and skill development services, where free subsidized when we talk about the welfare aspect, there the free which will when we talk about education and skill development services, then there are fees subsidized education. Many welfare systems, which include primary and secondary education, which has been made compulsory and free. They have equal accessibility to learning. Sometimes the schemes and welfare measures offer subsidies for higher education, for purchasing of stationery or uniforms, and etc. Then adult education and literacy program, vocational and skill training programs, all these have been taken up in order to, particularly if you talk about vocational and skill training program, it creating job opportunities, it enhances apprenticeships and skill development workshop, which would equip individuals with marketable skills, trying to enhance the employability and reducing long-term poverty. When we talk about literacy and continuing adult education programs, providing adults basic education and skills for improving employment and the prospects of their enhancing the quality of life. Then food and nutritional programs are also there, which provide food subsidy program. The programs like the supplemental nutritional assistance program there. And then in India you have the public distribution system, which would provide low income families with accessible to affordable food items. There is school meal programs, midday meal programs have been initiated with the two objective, that is to provide free and compulsory education, to enhance the enrollment ratio, to decrease the dropout ratio, as well as to improve the nutrition status of the children. Then there is community feeding program is also there. Sometimes the local bodies, NGOs, voluntary institutions, they provide some food relief or some kind of emergency food packages, food assistance to those who are in need or in some crisis. Then housing and shelter services are also welfare measures and welfare means which has been taken up. And there is public subsidized housing facilities, which has been provided by the government at a very low cost housing options for the low income families, thus trying to reduce homelessness and improving the living conditions. There are shelter homes for those who are in absolute poverty or who are extremely do not have any shelter. So there is providing, the government provides some temporary accommodation for homelessness individuals, along with the additional support services to the people to help them to transition, to transition from homelessness to have a permanent housing system. And there are various programs and schemes which looks into the, in fact you have a full-fledged policy when you talk about national policy for housing, which would look into the housing and shelter activities. Child welfare services are there, which talks not only about providing welfare measures to the children, but foster care and adoption services are there, who children who cannot remain in shelter homes, or who cannot remain, or who cannot be in their families due to the safety concern or parental challenges, they also have some kind of supportive environment. Child protection, child laws, legislations have been framed in order to safeguard, or in order to protect the children from any kind of abusive behavior, or any kind of maladaptive behavior, or any kind of exploitation or violation of child rights. So child protection agencies are there which would try to prevent abuse, neglect, exploitation of children, and would provide some services for the affected families. Even there are early childhood development programs which provide nutrition, health services. Then there is family and support, social support services like counseling and mental health services, substance abuse and rehabilitation services, which looks into the important aspect of relief and welfare. Then we have employment and labor welfare services also, which are being catered, which have been made. These employments and workforce development programs, they assist individual in finding employment, in seeking employment, in providing some assistance in job search, building and interacting, interviewing, coaching, mentoring, guiding, helping. Then they are labor tribunals, so that the people are updated and aware about any job vacancies in the government sector, in the public sector. Then workfare programs have been there. These programs, such as Manrega program in India, they guarantee work to an individual, to eligible individuals, which involves public works projects that would benefit the community. Then there is a scope for disaster relief as well as emergency assistance programs, providing some emergency financial aid. Government provides financial assistance and resources for individuals affected by natural disasters, pandemic, or any such type of calamity. So there are schemes, there are welfare measures which help the individual overcome the various programs. So, to help the individual to overcome various issues and challenges. Then there is a provision for temporary housing and shelter also in the wake of any disaster, or temporary housing facilities. Services are often being given to the people at safe places, or for the affected populations, which also include food and medical assistance. And then rehabilitation and reconstruction programs under the disaster. There are welfare measures and services which are provide a long-term benefit, including housing reconstruction, mental health services, counseling, community building, community engagement, construction of public utilities, construction of schools, colleges. So these measures have been taken by the government. Then you have legal aid and access to justice. When you talk about legal aid and access to justice, then free or subsidized legal aid. Legal aid programs offer free legal services, representation to the low income groups and families facing any criminal issues, or it so that to ensure that justice would be meted out regardless of their financial conditions or status. Then advocacy and support for vulnerable populations, services focusing on supporting specific groups, to navigate through legal systems, understand their rights and entitlements, and secure protection whenever there is a need. Then rights education programs, legal awareness campaigns, educating individuals about their rights, advocacy, empowering them to seek justice would be there. Social insurance programs would cover health insurance schemes, unemployment retirement schemes, old age and service benefit schemes, and then you have specialized service for vulnerable population. When we talk about the specialized service for vulnerable population, it program focuses primarily providing services for the elderly care, which would also include which would also include persons with disability or differently able people. Services include financial assistance, vocational training, accessible infrastructure, and community-based rehabilitation. Welfare services, they target the unique needs of even the indigenous population, communities, ethnic minorities, thus focusing on preventing, preserving their culture, improving access to resources, and ensuring equal opportunities. So we can say that each type of welfare services, I have named a few, that there would be many more, and they have more innovations and future trends in the welfare services. But anyhow, each type of welfare services, they address specific social needs, contributing to a safety net that promotes well-being, reduce poverty, and foster inclusion. The effectiveness of these services, that largely depends upon the adequate funding, target delivery system, and the ability to adapt to changing social and economic conditions. Now, if you talk about how these welfare services are being administered, how they are being delivered, how, in what manner, what is the entire process of procedure, the key aspect which are related on the, which are catered in the delivery of these welfare services. The delivery mechanism of welfare services is a system through which the welfare programs reach the people who need them, and it involves the design, the implementation, monitoring, and distribution of services such as healthcare, education, social security, housing, and income support to a larger population. Effective welfare deliveries requires collaboration between the governmental as well as non-governmental organization, private sector organization, and is essential to ensure the resources are being reach to the beneficiaries at a maximum in a more timely, accessible, as well as equitable manner. Now, these are the various key components of how the delivery should be made. These are the key components of welfare services, and how these welfare services would be made, would be formulated and implemented. Foremost is the policy and program design. Now, when we talk about policy and program design, need assessment has to be done. Welfare delivery starts with the assessing the needs of the population or the groups, and for this, data is being gathered around to understand the demographic, the economic, the social conditions, what are the specific challenges, and what has to be done in order to elevate that problem. So, the challenges faced by the target groups, a great analysis has to be done, a detailed analysis has to be done in order to identify the needs. So, it's practically the need assessment. Then you make up particular policies based on the need assessment. Policies are designed to address specific issues, to understand the issues. Then policies, they tend to establish the legal, financial, as well as operational framework for welfare services, and it set objectives, eligibility criteria, and funding mechanisms. The program designs are made in such a manner that the welfare programs are created to implement these policies, which would define specific objectives, services, benefits, support structure to the target population. Then comes the funding and resource allocation. In terms of funding and resource allocation, welfare services are typically funded through taxes. If you look into the government funding. So there are 3-4 aspects of it. There are either government funding, either it has been public-private partnerships, PPP, and there is some kind of international aid and grants. So if you talk about the government mechanism, it is the welfare services are typically funded through the government in the form of social, taxes, social insurance contribution, and public budgets. In many countries, welfare expenditure constitutes constitutes a significant portion of the government expenditure, especially in healthcare and education and social security measures. Then there is a collaboration of public and private organization institutions. The government collaborates with private organizations, to deliver welfare services. It helps leverage private sector expertise, innovations, and funding to complement public welfare services. Then apart from these two, there is international aids and grants in developing countries. In many international organizations such as the World Bank, UNICEF, IMF, they provide funding for welfare programs which focuses on various aspects of social issues. Then the service delivery channels. If you talk about the service delivery channels, there are government agencies, local bodies, non-governmental organizations, as well as community-based organizations, digital and online platform. Now, the government, of course, centralized and local government typically handle the delivery of welfare services. Local bodies are often responsible for implementing national programs at the community level, adopting them, and adapting to these services in order to fit the local needs and expectations. Non-governmental organizations also plays a very pivotal role in the delivery of welfare services, especially reaching to remote, marginalized or underdeserved populations and communities. They often work alongside government, which provides healthcare services and social assistance and social protection to the population. So, non-government organizations runs parallel to the government institutions in providing those welfare services, where in providing the welfare services where sometimes the government fail to reach, because sometimes the population may be residing in a very remote area. Then community based organizations are also functioning effectively in terms of service delivery of welfare. These local organizations often embedded within the communities they serve, they help bridge cultural and communication gaps, making welfare services more accessible and relevant to specific youth communities. Now, it is also about digital and online platforms. There is an increasing digital platforms which are used to deliver welfare services, particularly in financial aid programs where there is a direct benefit transfer system which sends benefits directly to the beneficiaries' bank accounts. So, these digital methods have enhanced efficiency, reduced leakages, and made services accessible to beneficiaries regardless of their location. Then there is registration and eligibility verification also. Sometimes beneficiaries, they need to apply for welfare services through online or physical registration process, and important information on regarding the identity, income, family size, and eligibility criteria. All these are taken into taken into consideration. They are collected. These data are collected through them to determine the qualification to avail these services. So there is a verification system also which has been very crucial in the welfare delivery to ensure that the services reach the legitimate beneficiaries, the more desirable, or I would say it reach to those who are in desperately need of these services. So many countries, they have now used digital identification system, like if I talk about our country, Aadhaar card, to authenticate beneficiaries, minimize fraud, and also to improve their service targeting. Then service distribution methods. If we talk about the service distribution methods, there are various kind of through which these services can be distributed, either through cash. There are cash provides financial aid directly to the beneficiaries, either as conditional or unconditional payments. Then conditional cash transfers require beneficiaries to meet their certain conditions which would require some kind of assistance. Then welfare services are often delivered in the form of goods or services such as food, rations, healthcare, public distribution system, subsidized food being distributed at a very subsidized rate to improve food security, and so on and so forth. Then there are some certain programs which also has vouchers or subsidies subsidies to reduce the cost of education. Then beneficiaries can redeem their vouchers for specific goods, and then you also have the services are also provided through designated centers, such as healthcare clinics, schools, employment offices, where beneficiaries can access resources, receive counseling, and can direct assistance. Then we have digital and technological integration. When you talk about digital and technological integration, has streamlined digitalization has streamlined welfare delivery services, which enables government to transfer funds directly to the beneficiary accounts. It had minimized any kind of fraudulent activities, ensures timely payments, and had also improved transparency and accountability on the part of the beneficiaries receiving their benefits. Then there is a technology of mobile which allows beneficiaries to have accessibility to services, track benefit status, and receive alerts. These platforms provide information, application forms, service updates, expanding access to it and reducing the need for physical visits. We have data analysis for targeting and monitoring. Data analytical tools are now being taken up by the welfare agencies to identify beneficiaries, track service usage, and monitor programs continuously with effectiveness. And these tools try to help improve service target, which would detect any kind of fraudulent activity and ensure resources are directed to those in need. Monitoring and evaluation, performance monitoring, beneficiary feedback, impact evaluations are important aspect in the monitoring and evaluation of the welfare programs, which would require continuous monitoring and supervision to assess their effectiveness, efficiency, and benefit, and which may include service delivery, timelines, coverage, and it also talks about the beneficiaries' well-being and how much it has impacted the life of the beneficiary after receiving these welfare services and measures. So, in a way, it also tries to collect feedback from beneficiaries, which help them identify the areas for improvement, any scope for improvement, which would ensure services are actually being taken up, and services actually meet the actual needs of the target population. Feedbacks mechanisms such as surveys, helplines, and digital feedback portals would help address these issues. Then the impact evaluation, apart from the monitoring part, periodic evaluations assess the social and economic impact of welfare programs. This impact assessment helps in making the welfare programs more effective, more rational, and also it has a long term effects by allowing any adjustment or improvements based on the evidence or based on the socioeconomic changes. So it through the welfare services which are more flexible in approach, they are being taken into consideration. Then challenges in welfare services, there would be certain challenges. If I specifically look into it, that what challenges would be there, it is not always very easy that these services are catered in a very effective, being delivered in a very effective manner. Although lot of efforts are being made, but still there are certain challenges, like first it would be administrative complexities, managing large scale welfare programs which would involve complex administrative processes, often leading to sometime delay, inefficiencies, and it would high operational cost. Reaching rural reaching rural, remote, and undeserved populations remains a challenge till date in many parts of the countries. And geographical barriers, digital divides, and lack of proper infrastructure, welfare programs are also tend to become vulnerable to leakages, with funds or benefits sometimes being misused misdirected due to corruption or administrative inefficiencies. The digital systems and monitoring can help minimize these issues, but it requires a robust implementation. So a lot of care has to be taken up, a lot of monitoring and supervision, and meticulously you need to monitor how this delivery service system is being administered and how they are reaching the target population. Then sometimes, you know, the limited resources, or I would say the budget control constraints, are often limit the scope and effectiveness of welfare services, especially during the economic downturns or crisis. So government faces the challenges of balancing limited resources while addressing these issues. Then adaptation to welfare systems need to be more adaptable to changing economic and social conditions. For example, new services may be required in response to demographic changes, pandemic or economic crisis. Then there are innovation and reforms in the welfare services. It is very important that every country, they should explore uniform basic or universal basic income as a means of simplifying welfare delivery by providing unconditional cash payments to all citizens. Though you know, UBI aims to provide a safety net without complex eligibility requirements, but still it would be more of an experimental measure to bring about such a kind of a universal basic income. Then decentralization of welfare services, welfare delivery to local governments and community organizations, enable services to be tailored to local needs, providing responsiveness as well as accessibility. Then there has to be an integrated approach, because many governments are developing one-stop digital portal where citizens can access multiple welfare services through a single platform. These portals simplify accessibility, improves transparencies, and ensure uh, and ensure resources are directed in those who are in need. Then there is again, if I talk about the monitoring and evaluation part, welfare programs, they require continuous monitoring to assess effectiveness, efficiency, and beneficiary satisfaction. Performance metrics may include service delivery timelines, coverage, and also include service delivery, you know, or also include the impact of beneficiary well-being. And in fact, the feedback would help, the feedback collected from the beneficiaries would also help to identify major areas of improvement, and to see that how these needs are actually met. So the welfare delivery system mechanism, you know, the delivery mechanism is crucial for translating social policy into effective support for citizen, enhancing resilience, and promoting social equity through continued innovation, efficiency improvements, and emphasizing on equity. Welfare service delivery mechanisms aims to provide support diverse populations and meet their needs sustainably. I will stop here today. This is the end of my lecture, first part of the lecture. Tomorrow I'll continue with this lecture with few more points added to the welfare services. Thank you.